Hello.
Hey, Anne Marie, how are you?
I am doing well. How are you?
I'm good. Listen, I'm gonna stay on, but I have to report off in another meeting at 2 o'clock, but I'm still gonna stay on
Okay.
this one, okay? I only have to do a 5-minute report, so I'll keep listening to this meeting and then I'll be able to chime in whenever you need me to.
Okay.
Okay. I had actually 3 meetings at 2 o'clock.
Oh, wow.
But I emailed a report to the other one, so that was taken care of.
Yeah, there's certainly more meetings than there are hours to commit to meetings.
Yes, but at least this way I can report off at the other one and leave and then
Yep.
still stay on this one.
Well, I'm not getting in somehow.
We hear you.
I know, but I'm not getting I can see you, but my picture isn't there. I don't know what it's doing. It keeps telling me I have to leave and rejoin.
I don't know. Yeah, because sometimes I can find something where it'll say ask to start video, and I'm not even seeing that as an option.
I'll go out and try again.
Okay.
Now can you hear me?
Yes.
But it
Still
says
can't see
join.
you.
No, that's all right. I don't care if you can't see me as long as I can hear you.
Okay.
I don't know why it's doing that. Oh, well.
I don't know if they can hear you or not. Still got 5 minutes, 4 minutes.
Yeah. What do I do here?
That's it. Check let anyone in yet.
Okay.
council endorsed the idea.
Okay.
I don't.
Hi, Anne Marie. It's Nancy.
Hello, I was muted.
I've also been zeroed out on the picture, on the video.
I don't know why there's something.
It says it's you.
You gotta let me in,
Okay,
Anne
I
Marie.
don't know what the problem is.
Anne Marie, it says you cannot start the video because the host has stopped it.
Okay, try it now.
Okay.
I-
Yep,
Not yet.
I got mine.
No,
I'm not sure the world is a better place as a result, but that's okay.
I see Nancy now.
There I am. Okay.
Yes, the mayor.
I was wondering why nobody had their video on.
Now,
You were
I
black.
don't know. Now I'm there.
I still don't have.
Honey, it's starting now.
No, Dr. Marvel's still without it. Oh, there he
Yeah.
is.
There you are.
Paul, I like your office.
Yeah, thank you. I'm certainly
Nice address
multitasking
you
today.
have there.
Yeah,
You double as an Uber driver?
it seems that way, yeah. I'm in Newark for a meeting this afternoon. So it just finished up.
Great. Hello, Dr. Tam. How are you today?
Fantastic, sir. How are you?
Okay, I saw you were talking to me from the WRDE as I was eating my bowl of oatmeal this morning. On your commercial appeared, or our commercial appeared.
How'd it look?
It looks good. Looks fine. Yeah. Thank you.
Are you promoting vaccine?
No, actually, we're promoting visiting businesses in Lewis.
Uh.
Of course, we're promoting vaccines.
We don't have to promote vaccines.
I'm just starting my town meeting.
Vaccines are self-promoting, aren't they?
We just have to get them.
All right.
Right. So Anne Marie, are we waiting for anybody else?
We're pretty good.
No, I think you're good.
Okay. So I guess before we get started, there are minutes from the February 16th meeting, if we could get a motion to approve those.
I didn't get them.
I didn't get them either.
Okay. I have them. I'd make a motion,
Okay.
but if the other two didn't, if Susan
They
and
should be attached to the agenda.
yeah.
Did not get them.
I didn't get them.
Well, then maybe we shouldn't approve them.
Yeah, we'll just hold and then we can do that the
Yeah.
next time.
Yeah.
Okay.
Great.
For quality and safety. How is everybody this afternoon? I know that's largely a rhetorical question when we're on, but hope everybody is doing well.
Who's speaking?
I don't know.
I think it was feedback from somebody not muted. So
Okay. All right. Perfect. So David, do you want to give us an update of where the hospital is right now?
Absolutely, Dr. Cowan. I think it's fair to share this with the community. We're down to about 5 or 6 on an average basis COVID patients in the hospital. Usually, as you know, I do not make that public, but I think we've been at a good number for the past week, a week and a half. We're being very cautious about about celebrating, but I will also say that this is something that at my call with the governor and the other CEOs yesterday is reflected across the entire state, where every health system has seen a dramatic decrease in hospitalizations. And so, that's worth celebrating. And and being grateful for right now. As we continue to ramp up and, as more people get vaccinated, and as you know, the CDC has come out with specific guidelines with respect to changes in, activities that are restricted in situations where people are vaccinated. We have now also lifted some of our visitor restrictions. Or I should say, we're in the middle of looking at that. We're changing our screening process for employees and physicians here. And my hope is that as we continue to move in the right direction, we will see an improvement in our visitor policies so that more family members are allowed to come in and see patients, who are admitted. There's a balance to all this, so please know that from a public perspective, all things are moving in the right direction, and BB's also moving in that direction as well. From a vaccination perspective, we have not yet ourselves received Johnson & Johnson, although the state has, and the state has been giving them in the larger vaccination events. I know that they had an event at Seaford High School, maybe this past weekend, where the Johnson & Johnson vaccine was given for the first time. We are still, according to the governor, in 1C, although once again, he's also been able to get a certain amount of vaccine reserved and given for educators, teachers, in an effort to continue to increase the vaccination rates for teachers so that schools can open and stay open at a greater rate. So BB continues to do 4 vaccination sites every day throughout the county. And we're still working on 1C as we run down our list. We have vaccinated 1C, so not healthcare workers, but just over 65 in Sussex County. We've currently vaccinated about almost 14,000 people. So that's the good news there.
So David, just for clarification, we're actually in 1B, not 1C.
Okay.
Is that
I'm
correct?
sorry, 1B, I beg your pardon.
Okay, thank you.
Right, huh?
Right,
Yes.
1B.
Right.
Our staff have been told they're in 1C, so that was music to my ears.
I'm sorry. Thank you, Dr. Cowan. It's 1B, right?
Right.
Yeah. So I was on a call with the state this morning, and they have, you're right, they've received Pfizer, Johnson & Johnson. They've actually given all the Johnson & Johnson that they have, and they don't anticipate another shipment until later this month. They are, however, receiving shipments of Moderna and Pfizer. Apparently both those products were delayed, I think, with the weather in the Texas area. So there's another big, there's an 8,000 dose vaccination event in, I believe it's Dover this coming weekend. That's both with Moderna and Pfizer. So yeah, hopefully we're kind of headed in the correct direction. It is, Dr. Tam, you're correct that our numbers are really low. I will caution people though that people are still getting sick with it. And, just yesterday, a close family friend is very sick with COVID, unfortunately, and we're so close to the end. We really need to encourage people the best they can to continue to socially distance and wear a mask. I think the CDC guidelines will be a little confusing for people. It'll be tough for them to understand why they can be with some people without a mask and not others, but it's important for us we're almost there. We really are almost there. It's a matter of weeks now, I think, until a really significant portion. Once we get into 1C with the significant vaccination rates, I think we're going to be in a really much more comfortable spot. So we're almost there, but we're not quite there.
Are any of you running into people who are totally against receiving the vaccine? Most of the time they say they feel it was produced too quickly and without proper safeguards. And I think that's from what I can understand, that's not a good reason, but have you all run into people in that situation?
No, the people that I talked to that have been reluctant to get the vaccine, it's been mostly been young women, and there's a concern about if they should become pregnant or want to get pregnant in the future, that the vaccines weren't studied in that subgroup, and it's true. What I tell them is that there were patients in both the Moderna and the Pfizer study that became pregnant during the study, and there were no untoward events reported. Pfizer is specifically studying their vaccine in pregnancy as we speak. I don't have any idea when that data will become available. I think the other subgroup of people are just the people you talked about, Jim, that just said it was rushed. It was really a Herculean effort. It is, equivalent to landing on the beaches of Normandy. I think is probably not an overstatement to get this vaccine produced. And I think a lot of those people they're coming around because they have lots of friends and colleagues that have gotten the vaccine. And, there have not been any significant unexpected events. All of the side effects are what we described to people in that first 36-hour period. So we're getting there. So I'm optimistic as we go forward that we'll have
Is
less
that
and
true
less
at the
vaccine
hospital
resistance.
as well? I know you had
Yes.
some reluctance at first at the hospital. Have people come around?
Yes.
Yeah.
Sorry,
Go
Dr.
ahead.
Cowan. The answer is yes, people are, that's why it's called vaccine hesitancy and not vaccine refusal, because there are people that over time have come around and said, this is something that I now have done more research on, have read the literature, have talked to my colleagues, and okay, I'll do it. And so we continue to see a ramp up of people who are getting vaccinated. And I think we will never get to 100%, but I think we have a high degree of probability that we'll continue to get closer to that number as time goes on.
The meeting I alluded to this morning, we were discussing EMS providers in the state, and there are a significant number of EMS providers in the state that initially declined the vaccine that now want the vaccine, which is a really good sign. So we're getting there, and it's not unexpected. It's brand new. There's people that are rapid adopters to new things and people that take their time. So I feel like we're getting there. Not unexpected. I mean, I think this is exactly what we expected.
There is some reluctance by some staff members. We don't know the exact number of who's getting vaccinated. We have the educator program through the state, and even the data through that, we're able to get really good data because of maybe how the registration system was set up. But I know we have a lot of staff members receiving vaccinations not through that system. So we don't know unless, we ask them personally, and we have to be careful about, obviously, those kind of questions on that topic with staff members for privacy reasons. But we have more than half of our staff are willing to get vaccinated. I don't know the exact number though. We are stressing the importance of vaccinations. It's sort of just based on the recent, report just about 2 weeks after your second dose and sort of how that could play out. That could have really big implications for classrooms, not just for staff to work together, to work with students, but also students 16 years and older eventually, could be in the same classroom together and actually kind of help us get more and more students into the classrooms for the rest of this year and into next school year.
That's great. I wanted to thank you for joining us. You've since we've had somebody from the school district, I think the meetings have a little bit more flavor. So I appreciate you taking your time to be with us. Have you vaccinated all of the employees of the district that want it, or are you still working through the willing people?
We're still working through it. We did, I believe, offer and complete everyone in stage 1, which are either elderly or those who work with special needs students and wish to be vaccinated. Students may have more difficulty masking 100% of the time, those types of things. And now things are opened up in the state to stage 2 people, which is the largest portion of educators in the state. I do know there's a large event even at Dover Downs this weekend, some other places that hopefully staff members will take advantage of. I know there was a local vaccination event, maybe even at Walmart or something recently that I think, several of our staff members, we could have 14 staff members went there the other day just to get vaccinated. So that's good to see they're just kind of taking advantage when they can get it and doing it.
So Walgreens has an agreement with the federal government where they receive vaccines sort of outside of the normal state distribution. And they've been asked to concentrate on 1B educators at this point. So that is another access point for your staff. But you do think you still have staff that are looking that have not been able to secure a first dose yet?
Yeah. Yeah. Yeah, that just opened up recently for stage 2 people within the last week or two. So we definitely have more available.
As far as your hybrid program, you have any end in sight for that, back to full in-person teaching?
I don't have a date in mind. It all depends upon the protocols that are in place for us. We have elementary kids back 5 days a week, but that's 70% of the students that we can only facilitate, and that's when the year started. We have roughly 40 to 50 students per elementary school who are on wait list to get into that 5-day-a-week program. And we have all of our middle school and high school kids are off the waiting list now, but that's only 2 days a week. And we're at our max there pretty much. We are working through a plan to finish the school year to increase either numbers of students, to create maybe even some unique opportunities for more classroom spaces, as well as considering, the high school, middle school, or 2 days a week, maybe doing a 3-day a week and kind of alter those days each week, just to kind of increase the number of days even between now and the end of the school year.
So you do have plans if things change?
We definitely do. We have plans if they don't change, and if they do, even more so. We're also going to be presenting in our upcoming board meetings in March, April, May about those plans, about summer programming because of students who have been remote. And we understand that there are more challenges with students with learning opportunities when they're remote versus in person. So we're kind of also planning to pre-teach information, to catch kids up to maybe some concepts they did not get to the level they should have gotten. And also thinking about next school year and those types of programs. We're naive to think that we've been out of school in person for a year and that within 3 months, everyone's going to be kind of like back to where they were. And so we started by surveying our staff. So we're collecting that information now to see who's interested in teaching summer school. We hate to put together a lot of programs for hundreds of kids if we don't have the staff available right away. So we realize it's more than just a summer project. It's going to be moving into next school year, probably the whole next school year, to kind of work with students and families to provide what we identify as the areas that they may have not, learned as well as they should have.
Right.
Sure.
Thank you.
Dr. Tan, as you consider changing the visitation policy, will that be one of the, whether or not someone's vaccinated, will that be an influence on visitation?
Probably not. But that is a good question. As one of it is, really learning what the CDC keeps talking about with respect to if people are vaccinated or not vaccinated, how many people can go in a room. I think that's where Dr. Cowan's point about people will still need to be wearing masks. Right. People will still need to socially distance and wash their hands, or physically distance and washing their hands, is going to be critical. We've of course been letting people in, in many circumstances as visitors when they were not vaccinated, or we didn't know, they had no vaccine. And I don't think that will change with respect to our policies. I think where that will make a difference is sort of that sheer volume of people who are vaccinated in the community in terms of what we decide we need to, will allow us to safely bring in more visitors, volunteers, all those people back into the health system.
What is the city's continuing attitude regarding large gatherings?
We're not doing anything until after the 15th of April in terms of allowing signing off on gatherings. We're kind of following the governor's advice and And we're waiting until, the council voted to wait till the 15th of April before we signed off on events.
Right.
So what specific events are you considering?
Oh, weddings, social gatherings and
Oh,
things like that.
weddings are a whole different issue. Janet and I have found out as she's talked to public health, because the public events are easier for like the 5Ks and things where there's an event organizer and they're open to the public. The things that I think are going to be difficult are the bonfires and the weddings, because what public health has advised us is that we, as the property owner, so if it's an event in a park on a beach, we have to develop the protocols and enforce them. So if somebody wants to have a wedding on the beach, we need to make sure that they know that every guest, and some of the weddings are 5 people, 10 people, it's not a big deal. But, we have a couple that are planned for later months that are upwards of 100 people. And we would need to get the public health clearance, not the people holding the event. And we are the ones who are responsible for making sure that the guests are wearing masks, that they have hand sanitizing stations, and these things are in place. So Janet and I are just starting to figure out how to even get our hands around that, because again, we're not gonna show up at somebody's wedding and, so it creates a different dynamic that we're trying to work through at this point.
I do understand that there's an event scheduled for later in March on the beach about a full moon gathering.
It does not have a permit. It is not.
We haven't received an inquiry about it.
I will have Janet reach out and let the organizer know that is not allowed.
We did authorize one back in October that turned out to be a much larger gathering than what it was presented to be.
Yeah, and then we kind of shut off all permits.
The reason I was asking is I understand the sunrise service has not been approved. Is that correct?
That is not, we are not able to approve the sunrise service.
Right. However, the chamber did file for the British Car Show and with Department of Public Health, and has been given authorization to hold that, greatly modified from what it was in previous years, but they did get authorization to do that. And that'll be out at the ferry, on the ferry's terminal grounds.
And
What
we
would
have-
happen if a group has a gathering that has not received a permit? Would they be arrested, or what would be the protocol?
I'll need to talk to the chief. I don't think they're gonna round people up and take them to jail, but I think that they need to disperse the event. And it's possible that event organizers could be fined. If somebody has obtained an event permit for an event they've held in the past and holds that same event without a permit, then they are specifically not compliant. It's not,
Right.
it's
Right.
not a issue of ignorance.
Take jail would
requirement.
ruin the social
So,
distance.
Yeah, so we need to, as the weather improves, we're going to have to monitor, because these things that have had permits in the past and have now been told they're not eligible for permits, if they go forward, then, that's a problem.
I see.
Yeah, I think that's going to be the challenge for the town going forward. To
Absolutely.
find a responsible way to open up. So
It seems easier than it is once you start getting into the logistics.
sure,
Yeah,
that's why we elect the mayor.
Thanks. Well, right now, we're continuing our mask wearing policy downtown.
Right.
And we're going to continue it for the foreseeable future. So, thank you.
I did want to mention that we've been in communication internally, just planning and thinking about different scenarios for events for the high school, including like graduation and how that could look this year. You know, we've sent some preliminary plans to DPH to get some feedback. And so we're thinking through a few scenarios just based on where we are at the time. So they suggested we kind of hold off for a few weeks to maybe get more of an updated set of protocols that maybe we can kind of fine tune some of our planning. We want to do as much as we can for the students and their families, and while still following all the protocols necessary. So we knew we'd have to start planning very, very early for that. So we've been probably a month or two in already to start this conversation. So our students have as much as we can give them in a safe way.
I'm a little confused in my reading. Is the cancellation of middle school athletic activities a local rule or is that state?
A local decision. It's a local decision. And you know, I made that decision because I don't, first of all, I don't believe that we're out of the weeds yet. And I feel that we've done a lot of things very well. And we have a very high percentage of our students that have been back to school in person since September, which is more than I believe any other district in the state. And that's where I want to put my efforts and my resources and my focus of doing what we've done well and continue to build on that with kids in classrooms, and not to try to do something different towards the end of the year for middle school sports. And a few local districts in Sussex are thinking about doing middle school sports. It's like a 3-week season. They're going to start after spring break, practice 3 weeks, and have 3 weeks of games. And I'm just kind of weighing the sort of the.
I think that's very reasonable.
Just the reason to do that versus I want to put my eggs in a different basket, which is getting more kids into in-person instruction for transportation purposes and those kind of things. And it's not an easy decision because I do believe students would benefit from the activity and the socialization of the athletic programs that we have at a middle school level. However, I also feel that really could, if we had any types of cases that would cause quarantines with bus staff, then we wouldn't have kids getting to school because that's how tight our bus staffing is right now with number of buses available and students available. And you know, we have a lot of our kids that aren't in school every day. So we now have to get the kids from home to school for practices every day and then home again, and then get them to athletic events at the same time when other buses are used for elementary school. So it's because they're on different schedules. So there's a lot of things going on. And I'm just trying to focus our efforts on school and instruction versus middle school sports for 3 weeks.
I'm glad I don't have your job.
Dr. Cowan?
Yes.
Chairman, if I could just jump right in, because I do have to step off at 2:30, but I do want to make a commentary on this one because as you all know, by the way, next week, I'll have been here an entire year. Seems like 5 years, but also seems like 2 months. I do want to say thank you to everybody on this call. Everybody's been so gracious and supportive of me personally, as well as my family, and also Dr. Cowan as a board member and also a colleague. Just been, it's one of the reasons why I'm very excited about, many more years here. I do also want to, though, in that note, just publicly say that Bob has done an amazing job. My family still straddles, right? I have one step kid who's still in California because high school is a difficult time to transition. So I have one who's a Cape Viking and one who's still in California. It's been a difficult thing, but I just applaud Bob as well as the Cape School District for really being deliberate and staying on course. Because I can tell you, there's nothing more challenging to a kid, and we've witnessed this, of going back and forth, back and forth, back and forth, and maybe it's because my stepson is likes remote learning or not, but they flourished here, and I just want to share my kudos with Bob and his team for keeping us on the course. I think that's been a really important thing for the kids.
Thank you very much.
I certainly agree.
Great.
Not easy.
No.
Yep.
And then on that note, sir, if it's okay, I'll step off. I got another board another board commitment that I must make. So Dr. Cowan, I apologize if I have to step off, but please let me know if there's anything else that I can answer for you all.
Great. Thanks,
Happy
David.
anniversary.
I can't, you know what? I can't wait for the summer that I was promised when I took the job, right? Like, there was no doodah parade. So we'll see
Actually,
you
there
there.
was, that was one of the problems.
Right.
So you'll be really excited about our summer traffic, Dr. Tam. Stay away from Route 1.
Yep, I will.
All right, take care. Thank you.
Thanks.
Savannah Road's getting almost as bad as Route 1, particularly in the mornings and evenings, early evenings.
Yeah, there's going to be a lot more development on there too.
Yeah.
I know there's a lot of construction right now and most of those flashing signs, electric signs are telling us to expect delays, but I thought it was very helpful last year when they put the mask rules and things as you went toward town on Savannah, as you went toward the park. And I'm already seeing the traffic increase on Savannah. I assume people are coming from outside. So maybe it's time, as you can relocate those signs, to think about putting the messages back up. And the fire station was very good about it.
Those message boards come from DelDOT. We have to get them from DelDOT, so we can certainly try, okay?
Good. Okay.
Paul, you're frozen. Your screen's frozen.
Yep. So I'm not, yeah, I'd like to comment just before I froze. Do we have any other topics that need to be covered? Other than it?
I don't think so. I think we're good.
Hi, Cheryl.
Hey, sorry, I had a technical
Is my screen
issue
still frozen?
here.
Yeah.
Yeah, well, I was having technical issues today too, so. Did you guys need anything from me while I was having issues with my computer? Okay,
I think we're good, Cheryl. Thank you.
okay.
How are you, one thing, how are you doing with supplies? Are you stockpiling them or are things moving along reasonably well as far as the delivery system is concerned?
Actually, we're doing very well. We have plenty of supplies. Things are coming in. We don't have any issues with the supplies at this time. And as the other hospitals report on my committee too for the state, everybody else is doing the same thing. So we're doing fine with supplies. We're good.
Good.
Good. So I guess the last topic then is we need to find another date to meet.
Yeah, 3 weeks from today would be the 31st of March. If we want to stay with Wednesday.
That's fine. What
Is that
time?
fine
What
for-
day of the week is that?
That's a Wednesday. Does that work for you, Paul?
Yes, yes, it does.
1 or 2
Cheryl, is
o'clock?
2 o'clock a conflict for you, or is that just a today thing? 'Cause I know
No,
you
that
guys
was
are-
just a today thing. Yeah, it's okay. Well, I'll be fine then. Pretty sure anyway. Yes, because I had an unusual meeting. It's only a quarterly meeting on Wednesdays at 2 o'clock, of course.
Okay. So Wednesday, the 30th, or I'm sorry, 31st at 2? Is
Yeah,
that,
we need to confirm that with
Yes.
Lynn, I guess.
yeah, I'll email Lynn as soon as we're done here.
Okay, great.
Yeah,
Okay.
okay, sounds good.
Okay.
Dr. Marble, have a good vacation.
Thank you.
I leave Friday.
We're leaving tomorrow.
I know.
Well, everybody have a good time.
We will.
We'll be thinking
All
of
right, thanks. Thanks, everyone.
Thank
Thank
you.
Very much,
Thank
Paul.
you.
Bye.
See you.
Bye-bye.
Thanks, bye.
Bye.